Olivia Fierro, we hear about the dangers of addiction to prescription painkillers often, but what about the risk of just having them in the home? Dr. Thompson joining us this morning with the impact it's having on children. Good morning, Arizona. Welcome back to Good Morning Arizona. Opioid use has reached epidemic proportions, and now we are seeing its dangerous impact in new ways on children. Dr. Sharon Thompson of Central Phoenix Obstetrics and Gynecology gracious enough to join us this Monday morning to talk about some of the other impacts that the use and prevalence of these prescription painkillers and also, of course, heroin and illegal street drugs are having on children.
Yeah, I mean, one of the things that is so dangerous now we know about these medications is their long-term impact.
Okay.
So we're seeing more and more across the country and in Arizona, babies born affected by these medications. Because of course, when mom is on the medication, it crosses the placenta and gets into baby circulation. When baby is born, baby's no longer getting the medication, and so they withdraw from the medication. So we're seeing more and more neonatal abstinence syndrome, where babies have to be cared for, especially because they're affected.
I've talked with NICU nurses before about this, and they say that it is so devastating because these babies are it's almost impossible to comfort them, and that their cry is sort of a different, what they experience, it's almost like they're being tortured in their first days and weeks of life.
Yeah, we don't know the biochemistry specifically, but we know that these medications affect neurons, and that's what we want when we're looking for pain relief. But when babies are withdrawing from them, when they don't get the medication anymore, it makes them irritable is probably a good word, where they're stimulated in ways that a newborn normally isn't. And so it's hard to figure out in a newborn, how do you comfort, how do you care for that kind of stimulation at a neural level? Do
we know much about the long-term implications of that as well?
We don't. Okay. We don't. We're unfortunately going to learn. Yeah. And the other part of a neonate being affected is that, of course, you have a mom who is affected by overuse of these medications as well. So in that newborn period, when it's so critical for newborns to have that care and love and nurturing from a mom, the neonate is affected and the mom is affected.
And certainly
so
that
it's sort
bond
of a
is
double
compromised.
whammy.
We want to also talk about something that I had not really thought about much, and that is the more that these drugs are prevalent in the homes, the more likely that a child can get their hands on them, either intentionally or accidentally, and that's really being proven with the number of calls to poison control.
Yes, definitely. And also what we see in the spread of the epidemic is that if for teenagers, it can start with mom's leftover Vicodin or dad's leftover oxycodone. They take one from the cabinet, and that's where their addiction begins. So definitely having these drugs in the home can lead to some unintended dangers. So important that if you have a prescription that you didn't need all of it, because pain medicine we use as we need it, take it back to a pharmacy. The state health department has teamed up with Walgreens, and so there's several locations around the valley where you can return your unused medications. That's the best thing to do with them.
And it seems that the policies are changing a bit to try to curb the problems with these painkiller addictions. What changes are you seeing, and what seems to be working?
In fact, last Monday, Governor Ducey declared a state of emergency in Arizona to address the rising number of overdoses that we're seeing in the state. And so the health department has developed different policies to address this. One of them that's so important is making the life-saving drug naloxone available to anyone who goes to a pharmacy. So if you're living in a family or a neighborhood where you know drug addiction is a big problem, you can go to the pharmacy and request this medication. The director of the state health department has a standing order that anyone can access this medication that can be life-saving. Too many people die because they don't have access to this medication.
And usually EMTs would have that, but,
EMTs will have
time is of the
absolutely,
essence.
but time is of the essence. So having it in your household can save a life. That's one thing. Another one that I want to mention is having more providers trained to treat drug addiction so that we can decrease the number of people who are affected and then the number of babies born.
See the signs early. Dr. Thompson, always great to see you and have your insight. Thank you so much.
Thank you for having me.
Have a great day.
Topic.